Hi, and welcome to Molly's Casual COVID Corner, where we will be discussing in a casual, easy to digest, easy to understand manner the current events surrounding COVID, surrounding the mask mandate for today in particular, and we will be diving in, seeing what some of those things mean, seeing if this is constitutional, looking at some numbers, the whole time keeping it really casual, really easy to understand, so hopefully we can take a couple things away from it. So to start us off, we are going to be looking at some statistics and numbers from the Texas Department of State Health Services. This is essentially breaking down for us the number of confirmed cases, fatalities, new cases, and on that right-hand side, you see all of the counties that have the highest number of cases from largest to smallest. What we can gather from this infographic is that Texas has performed over 4 million COVID tests, 481,483 coming back confirmed. Of these confirmed cases, over 8,000 have resulted in fatalities, and on a daily basis, we are receiving close to 7,000 new confirmed cases. So what we can gather from this information and what matters to us as citizens is the counties that have the most cases. So we'll be looking at 5, and what percentage of the population is contracting the disease and has the disease. So in the number 1 spot is the Harris County, which is Houston and the surrounding areas. They've contracted 81,919 cases, which sounds like a lot. It is a lot. It's the county with the most recorded contracted cases of COVID-19. But when we break down the numbers, so if we take the total population of Harris County, which is a little over 2 million people, and we divide that 81,000 by 2 million, you get a contraction rate of 1.73%. Dallas County, which is the Dallas and the surrounding Dallas areas, not including Fort Worth, has 52,869 cases. Number 3 is Bexar County, which is the San Antonio surrounding area. They have 34,687 confirmed cases. Tarrant County, which is the Fort Worth and the Fort Worth surrounding area, has 30,650 cases. And then finally, we have Travis County, which is where I am living at the moment. And in Austin and the surrounding areas, we have 22,256 confirmed cases, which is significantly less than that of Harris County. However, if we break down those numbers again, so 22,256 cases, and we divide that by Travis County's total population, which is just over 1 million, we have a contraction rate which is higher than that of Harris County, which is 1.74%. So just a hair higher, but you need to do the math and critically observe what we're looking at if we want to determine. So now that we've looked at some hard, firm numbers, they are changing every day as this is an ongoing pandemic. We can take a step back and look at what Texas has done to help, which will segue us straight into the mask mandate. So now that we've looked at some numbers that are kind of big, kind of scary, seem a little difficult to understand, we have broken them down, made it simple to look at, made it easy to understand. We can move forward into what Texas has done to help prevent the spread of disease. So if you remember, way back at the end of March, Texas. So now that we've taken these big numbers, we've broken them down, made it simple, easy to understand, we can take a look at what Texas has done to stop the spread of the disease. So at the end of March, Texas issued a lockdown, which meant that you were confined from going out and doing activities unless they were essential, which would be like grocery shopping, getting gas, going to work if you were still working and it wasn't from home. But this lockdown was lifted very shortly on April 30th. Texas was the first state to reopen, And this resulted in a very fast and aggressive uptick in cases, where we immediately saw the number of cases spike. And as opposed to other countries, other states in the US, even, we weren't plateauing at all. It was just continuing to go up, which caused Governor Abbott to issue something that we know as the mask mandate. So the mask mandate required all citizens in Texas to wear a mask when going out in public. So this means wearing something that covered your mouth and your nose, whether it be a scarf, a disposable mask, a reusable mask, and this was to help prevent the spread of droplets from your mouth, so my mouth, to other people such as yourself or those around you. So wearing a mask does not necessarily protect you from inhaling these things, but it helps to prevent what you're expelling, which is why it is important and only works if everybody in your vicinity is wearing a mask. So according to a study by the University of California in San Francisco, masks have proven to be extremely effective in the spread of COVID, but this is only if you wear a mask and the others around you wear a mask. So for example, there was a man who flew from China all the way to Toronto, and he was a carrier of the virus and he was positive at the time. But because he wore a mask and those around him wore a mask, even though he was positive and exhibiting active symptoms, those that were wearing a mask around him, even in the plane, which is a closed environment, tested negative. So by wearing this mask, he was able to stop some of those droplets traveling into the air system in the plane, into the air around him, thus making the other people around him safer and to test negative. So choosing the right mask and wearing the mask properly is really important when it comes to this mask mandate. Things such as disposable masks, cloth masks, scarves, bandanas, anything that will cover and stop the spread of droplets forward is an acceptable mask according to the CDC. Things that aren't acceptable are things with holes, obviously, because it's not stopping anything. And despite some beliefs, the plastic face shield, I wish I had one for an example, but the plastic face shield is only effective if you are using it in an environment where those droplets are being coughed or sneezed or breathed directly at you. So an example of that would be a nurse or a doctor in a hospital where they are surrounded by people who have tested positive for COVID. Those, with that being said, are only helpful in preventing you from receiving those droplets, but in order for it to be an acceptable covering to wear in public, you would still need to wear a cloth mask underneath because all sides of that are open. So you breathing out would just escape around the sides of the plastic. We will do a quick demonstration of how to properly wear a mask. I have one right here. It is one that my grandma made. It is cloth. It has an insert, which is a little filter, and another piece of fabric. This is just to make it a little thicker. She threw that in. But so like you can see, this is not medical grade. This is nothing exciting, nothing fancy, just a cloth mask. And the proper way to wear it is to put it over your nose, hook it around your ears, and then this one has a piece of wire, so you will pinch that wire on the bridge of your nose to help prevent it from going up. This is especially helpful to those glasses wearers. I wear glasses on a regular basis, and as we all are aware, it makes them fog up really bad. So if you pinch this, it is good for yourself, good for others. It's very helpful. Masks are not effective if they are worn like this, because as you can see, my nose is not covered. Therefore, when I breathe out, if I laugh, am talking, am winded, and I'm breathing out of my nose, those droplets, which live in your lungs, are moving up, out your body, and out your nose. So wearing it over your nose is very important. It also is not effective if you just hold it like this. See, I don't have it on my ears anymore. And this is because now, if you can see, there's all of this that can come out the sides. So to wear a mask properly, you hook it around your ears, or in some cases you tie it, and you want it to be covering and touching the sides of your face, covering your nose, and covering your mouth. So now we are going to, like I promised, talk about the public reaction to wearing a mask and kind of break down whether or not this is a constitutional infringement of your rights. So here I'm including just a couple pictures of some of these anti-mask protests, some of the posters that you would see. As you can tell, there was quite a large turnout and quite a few people vehemently opposed to wearing a mask. So according to the American Bar Association, the mask mandate is not in fact an infringement on your personal rights. It is covered by the 10th Amendment, which is state powers, meaning that anything that the federal government hands off, which would be the mask mandate, because cases vary per state, the state government has the authority to control and put in place things that will protect its citizens from things such as a global pandemic. So, because this is not a federal thing and it is a state issue by Texas, making that state mandate for something that is for the benefit of the public health and the benefit of the safety is covered by that state rights. Texas has the constitutional right to put something in place in order to protect its citizens, such as like the no smoking under 21 for Austin and San Antonio and all of Texas. That is something that the government, the Texas government, has put into place in order to help protect the health and safety of its citizens. It is also well within the rights of different establishments and institutions to refuse service, have you not wear a mask. So it's kind of the same idea as no shoes, no shirt, no service. Businesses reserve the right to refuse service and to turn people away and not allow them into their privately owned institution if they are not wearing a mask. So then that is not a discrimination per se, but rather a right that every business in Texas holds, where they have the authority and the liberty to refuse service have you not followed their rules, because it is their establishment. Thank you so much for joining me in Molly's Casual COVID Corner, where once again we take these information and things that seem really scary, we break it down into something digestible, and maybe learn a couple things along the way. I'll see you next time.